Microphone to stop. Hi everyone, and thank you for joining us today. We're going to give it 5 minutes just for everybody to log in. On the website 30z.com/live, you'll be able to join in using the Mentimeter. So you'll be able to answer some questions so we can get to know you, and you'll be able to pose questions throughout the webinar as well. But I'd like to introduce you to the guys we have here from ADEMA University.
Hello. Hello everyone.
And they'll be introducing us to their international master's program that they're launching with the Haptics as well. So like I say, just bear with us a few moments and we'll wait for everybody to join who's just been sent the email. So we'll be back very shortly. That's great. Well, it's lovely to see so many of you with us today, so thank you very much. And like I say, with the Mentimeter, you'll be able to ask questions as we go along, and we'll be able to pose you questions as well. So it's just opened up on the second page, and you're welcome to let us know if you've tried Haptics before, or perhaps you've already got them in your university or in your institution. So we'll come back to that shortly. And like I say, you'll have a button where you can ask questions. But for now, let's get straight back into it. and we'll show you what we've been working on. So a quick introduction for the company. My name is James Markey and I run up the head of sales for HRV, which stands for Haptic et Reality Virtuelle. My colleague Pierre-Jean runs the development team in France. And our CEO is Arnaud Carson. And the whole purpose of Haptics is how can we improve the standard workflow that goes on in teaching dentistry, using plastic teeth in phantom heads and then going to practice on patients in the clinic. So we've got 2 live demonstrations for you today, and the first one's using the full high-fidelity Vertizi dental simulator, which you can see there in front of you. And we're going to switch over now to a live stream from the simulator so that you'll be able to see what we're actually doing. So on the webcam now, you'll be able to see we've got a full Vertizi machine. You can see the haptics just underneath, a 3D mouse, and on the floor we have the foot pedal to operate. You can see there's a full classroom setup. We have a second simulator and a teacher PC as well. So we're going to place it just here so you can see what I'm doing on the simulator as I'm doing it, and you'll be able to see the screen live from the stream. So first of all is logging in as a student. We choose our login and then we enter our password. So I'm just going to use the default one that we have here. And then we have exercises in familiarization, so the building blocks to get used to it. And then we move to restorative class 1 to 5, endodontics, prosthodontics, and implantology. And recently we've also added the core operative exercises in collaboration with the University of Sheffield in the UK, which allows us to practice and test our skills and get validated feedback straight away from the simulator. So first of all, let's load up patient. And you see there the loading screen has ADEMA's logo on it as well. And then with the top screen, it's touch screen, so I can use it just like I would a phone to pinch to zoom, for instance. With the tool selection, we have our slow speed, our fast speed, and then our dental probes as well. So there, you can go ahead and choose a burn. And then you see, as I pick up the haptics, which has a real dental handpiece on the end. Once I touch the tube, I'm not able to push any further. And that's thanks to the haptics, thanks to the motors that are inside. And also, using a tracking tool, we're able to have indirect vision as well. So I can start the foot pedal to start the burn, and then I can drill into the tube. So I'll get the feedback from the enamel, the dentine. You can see there the moving some of the caries there. And then as we're working on, we have a real-time evaluation of the work. Works very much like a scan. And as we move along with the different views, we can see the different slices that come up there. In the top left, you have the evaluation. The criteria is set by the teachers. And you can, of course, set lesson notes with images and instructions for the students. And then when we're ready, we can actually go ahead and finish the exercise. And that takes us through to our workflow for self-assessment questions as well as the self-reflection. So I'll do that just over here to avoid me stretching over. So we can respond to the various questions on here. And then fill out a learning diary. For instance, do I need to improve my posture? and if so, why? And then all of this data is saved and sent to the teacher PC for reviewing by the teachers, and they can leave comments and feedback for the students as well. And now what we're going to show you is very exciting. This is brand new and it's just arrived in ADEMA. So we're actually going to bring you over and I'll show you the room. So we have various haptic desktop devices. So here, for instance, you see the same virtual patient we were just working on. It goes all around the room. But we're going to show you one in particular, which is the first time that it's been deployed. And just here you see a white simulator with slightly different haptics. And so this is for all surgery. So here you have, again, a virtual patient. You have a brand new haptic device that's come from Sweden. And just as before, we can feel it. We can't push any further. But it's got a higher force feedback, so we can replicate surgeries with the patient. See that I'm starting to remove some of the tools there above. And with this we have various tools. So we can actually cut away there, like you see, into the tooth, and we can perform surgeries onto the jawbone as well. And you see in the top right we have a little X-ray vision of our patient, and then just behind that, let's get it closed, you'll see the material that we've removed as well. So that's our brand new Haptics device, and this is to complete the simulation suite in ADEMA that they've got. So they've got 2 full vertical machines, 8 desktop machines, and we've also got now a portable simulator. And like I say, I can show you just over here from the presentation back. The orange case actually contains a fully portable simulator, so the first portable dental simulator in the world. And we'll just get you back. Here. And so they are the desktop simulators that you've seen in operation here. That's the laptop, the portable simulator that you can see in the orange case that we had on the side. And the last installment of it to create the VertEasy Classroom is the teacher PC, which we have just behind us. And that has an editor program so that you can create new exercises. They get transferred to the simulator, and then all that data is available through VertEasy Assistant, so you can do the evaluations, you can give grades to the students as well. And so those high fidelity simulators, they offer you validated assessments, implantology, indirect vision practice. And the desktop and the portable simulators are more affordable, so they allow you to really pad out your simulation suite and offer haptics to more people. And then when that connects to your teacher PC, you can add in intraoral and CT scanners, as well as connecting to your LMS system. So our improved digital workflow goes from reading the theory, practicing on digital teeth through the VertEasy system, and then you'd still use your phantom heads, you can still practice on the teeth, and there's also augmented phantom heads out there available. So then we can go on and really treat the patients. And what's really cool about that is being able to get the patient scanned from real life and bring that into the simulator. so you can practice on the real patient's teeth, but on a virtual patient, so you can make as many mistakes and learn everything you need to before you really go live on a real patient. And so that's a brief introduction, a brief demonstration into everything we've been doing at Verteezy Dental. And now I'm delighted to be able to hand you over to the team at ADEMA to talk you through everything they've been doing in incorporating the haptics, and they're also launching a new international masters, which I know a few people were interested in. So thank you very much, and I'll pass you over.
Okay, James, thank you so much for bringing us this opportunity to explain how is our experience with this kind of simulators with DENTISTRY. Let me introduce myself. I am Dr. Pedro Alomar. I am the head of studies of the School of Dentistry of ADEMA. I am oral surgeon, and I try to explain how is our experience with dental simulators in our school. Okay, how is ADEMA? What is ADEMA? How many years is ADEMA function? Then ADEMA is a dental school with universal treatments. We are in Mallorca, in Spain. It's in Balearic Island. And we have in our school is equipped with 10 simulators. We have 2 years of simulators experience. The most important thing is all our professors has the opportunity to evaluate the students and record all the practice the students do. What does this allow to you? Okay, for the students or for the teachers? For the students, offer intensive and prolonged practice opportunities, basic principle for automation, projection and transfer of learning to reality, technical improvement, acquisition of cognitive and psychomotor skills, and continuous objective and highly accurate evaluation and corrective feedback. What I try to explain is all the students can repeat all the exercise and can pre-operate in real cases or real patients if they want, as many times as they want. For the teacher, we can manage users and groups. They can create new exercises in addition to the program ones, use real patient scans and incorporate them into exercises, follow the progress of each of the students, evaluate too, and plan real implants. You can import for one real case to the Verteezy simulator, and you can, as I say before, you can repeat the treatment wherever you want or all the times you want. You can feel the sensation, you can visual sensation or ergonomic sensations too. In our degree, we have our program, which is divided in 5 years. With the first year, we have the subjects of human anatomy, legal and forensic dentistry, biomorphology of the stomatognatic system. This is the first year. And the second year, we introduce the simulators in dental materials 1 and 2, and prosthesis 1, and dental pathology. In the third year, we have dental surgery, prosthesis 2, pediatric dentistry, and endodontics 1. And the last years, the fourth and the fifth, is prosthesis 3, endodontics 2, pediatric dentistry 1, prosthesis 4, oral surgery 2, and in the last year, we have integrated dental clinic 1 and 2, and dentistry in special patients. Each student, each student has between 5 and 10 hours of practical use of simulator for each subject. This is the minimum we have. We can practice if they want 20 hours. ADEMA is open for every student as they want. Okay. This is yours?
Okay.
And my colleague.
Hello everyone. I am Mauricio from ADEMA. And I will explain you about our new program of postgraduate. In addition of our degree of dentistry, for the next course, for the next year, we will offer a postgraduate degree program we will be teaching all the new technology that we have in the school with the haptic simulators and the digital experience from ADEMA in dentistry. These postgraduates are offered to dentists, stomologists, maxillofacial surgeons, and prosthetics and oral hygienists. We're offering different degrees. One is a master in digital dentistry and new technologies, and then we have 4 different postgraduate diplomas. The master took the 4 postgraduate diplomas and cover all the subjects that you can see in the postgraduate diplomas. The 5 different courses, they are offered in 2 modalities, blended and online. The online is almost full remote in Spanish and English, and it starts in January and finishes in July. How we do the practices in the online mode is from January to June. You will be receiving all the classes in an online way, and then you have to visit our school in Mallorca for a month in July. So all the practice activities from all the degrees are concentrated in July. The different degrees that we are offering is the master degree in digital dentistry and new technologies, and the postgraduate diplomas are more specific for each specialty. We have digital orthodontics and dentofacial orthopedics, digital restorative dentistry, digital techniques applied to periodontology, surgery and implant, and prosthesis and occlusion, the new technologies that we can go in this area. So if you have any question about the program degree, prices, the hours that you have to take online, the hours of practice, you can use our QR code in here, and you can go to our website with all the information and our contact email, for you can get any answer, and we can help you in anything.
That's all.
That's all. If you have any question about how ADEMA use these technologies, or any question about the postgraduate degrees, please feel free for contacting us.
Okay. Thank you so much, James.
Well, thank you for that, and thank you for joining us for the webinar. I was just logging in to see whether we have any open questions. So let me bring up the Mentimeter. Okay, so we've had, from the people that answered, a real mix. Some people who have simulators already, some who this is new for them. And like I say, now is your opportunity. We'll leave it open for a few moments where you can ask some questions. But someone asks, how are we? So I'm doing well. How are you guys?
Very well too. Thank you so much. How are you too?
So what we're going to do, we'll cut the video, we'll cut our audio, but we'll still be here for 2 minutes. And like I say, if you wish to ask any questions, feel free to do that through the website, and we'll be able to answer them for you very shortly. But otherwise, if there's no questions, then it's been a pleasure. And we're doing this from the lovely place of Palma, Mallorca. So it's a great place to be coming in July to get to enjoy the beaches when you're not here at the university. So goodbye from us, and have a great day.
Thank you.
Have a nice day.